In this podcast episode, Gary Brecka sits down with Dr. Vonda Wright, a board-certified orthopedic surgeon and a leading expert in women's health, bone density, and hormone therapy. The conversation dives deep into menopause, perimenopause, and the wide-ranging impact of female hormones on health, longevity, and quality of life. Dr. Wright emphasizes that perimenopause, the transitional phase before menopause, can begin as early as the late 30s, well before many women anticipate any hormonal changes. This stage is marked by a dramatic depletion of ovarian follicles and a significant drop in estrogen production. Unlike men, who continuously produce testosterone with age, women's estrogen levels plummet as their egg reserves diminish, leading to systemic effects on the entire body. Far beyond just sexual or reproductive health, estrogen, progesterone, and testosterone act as critical systemic hormones essential to brain chemistry, cardiovascular health, bone density, mood regulation, and sleep quality. Dr. Wright stresses that these hormones are not merely sex hormones, but key biochemical messengers with receptors in virtually all tissues, highlighting why so many women begin to not feel like themselves during perimenopause. Symptoms such as brain fog, mood flattening, loss of libido, anxiety, insomnia, and physical pain are common, but too often dismissed or misunderstood. One example Dr. Wright explores extensively is adhesive capsulitis, or frozen shoulder, which disproportionately affects women in their perimenopausal years. She explains that this condition stems from inflammation exacerbated by hormonal deficiency, particularly the loss of estrogen's anti-inflammatory effects. Many women with frozen shoulder arrive at the doctor seeking localized treatment without awareness of the underlying systemic hormonal causes. Dr. Wright highlights the importance of treating the whole person rather than just the afflicted body part, noting that hormone therapy combined with a holistic approach can rapidly improve both symptoms and quality of life. The discussion on bone health underscores yet another crucial aspect of declining estrogen. Bone is not just a static framework, but a dynamic endocrine organ involved in mineral storage, blood cell production, and inter-organ communication via hormones like osteocalcin. Estrogen plays a pivotal role in maintaining the balance between bone resorption and formation. During perimenopause, women can lose up to 20% of their bone density, a process that greatly accelerates the risk of osteoporosis and fractures in later life. Dr. Wright paints a vivid picture of many elderly fractures resulting from fragile bones breaking first, not falls causing the break, an often overlooked clinical fact with significant implications for prevention. A central message from Dr. Wright is the concept of temporal disconnect, where individuals prioritize immediate demands over long-term health investments, leading many women to delay addressing perimenopause until symptoms become severe or disabling. She passionately advocates for women, especially those aged 35 to 45, to wake up to the importance of early intervention and prevention. Addressing hormone imbalances early during perimenopause, not just waiting for menopause at 51 or later, can significantly reduce the risks of stroke, cardiovascular disease, brain decline, osteoporosis, and other chronic illnesses by approximately 60%. Dr. Wright firmly believes that prevention is the best medicine and encourages lifestyle changes encompassing diet, weightlifting, impact exercise, such as jumping and sprinting, micronutrient optimization, and sleep hygiene. These foundational steps are essential before incorporating hormone optimization, which should be viewed as a part of an overall health strategy rather than a standalone magic bullet. One of the most compelling parts of the interview is Dr. Wright's candid discussion about hormone replacement therapy, HRT, and the persistent fears surrounding it. She challenges cultural stigmas and misunderstandings, particularly the misconception that estrogen therapy inevitably increases breast cancer risk. Instead, she points to modern data and large-scale studies showing that bioidentical hormone therapy can be safe, effective, and life-changing when managed responsibly. Dr. Wright clarifies that the hormones used today, especially estradiol and micronized progesterone, are not synthetic artificial chemicals but chemically identical to the hormones the body naturally produces. She disputes the logic of avoiding hormone therapy by opting for unproven natural remedies like soy or yams explaining that the bioidentical hormones are often plant-derived in their molecular structure and provide the exact signals the body requires. She further distinguishes the doses given in menopausal hormone therapy, which are generally lower and more physiologic, from the much higher synthetic hormone dosages in oral contraceptives, highlighting the irony that many young women take oral contraceptives for years without being cautioned against them. Dr. Wright asserts that if birth control is accepted at a young age, so should hormone therapy as a preventive tool during perimenopause. Dr. Wright shares touching personal testimony regarding her own hormone therapy journey and that of her wife, illustrating rapid and profound improvements in sleep, mood, libido, inflammation-related conditions, and bone density. She promotes a comprehensive approach that includes systemic estrogen, progesterone, and testosterone for whole-body benefits, alongside targeted vaginal estrogen to combat genital urinary syndrome of menopause, which affects a majority of women but is seldom discussed. The importance of starting hormone therapy in perimenopause rather than waiting for full menopause is underscored by research Dr. Wright references from a massive retrospective study involving 120 million women. This study demonstrated that early hormone replacement can reduce the risk of stroke, heart attack, cardiovascular disease, brain death, and osteoporosis by up to 60%, marking it as a game-changing intervention in preventive medicine. Alongside hormonal intervention, Dr. Wright advocates for lifestyle medicine, calling attention to how rarely lifestyle factors, such as sleep, diet, stress, and physical activity, are genuinely addressed in conventional healthcare, despite being well-documented drivers of health and disease. She champions the fundamental role of weightlifting, protein intake, micronutrient supplementation, and especially impact exercise to maintain bone density and muscle mass through aging. Importantly, Dr. Wright introduces the concept that aging is often an aggressive pursuit of comfort, where people avoid physical challenges, sprinting, or jumping, all critical for bone and cardiovascular health. She challenges listeners to reintroduce playful movement patterns, balance practice, and sprinting to optimize longevity and quality of life. The conversation touches on the alarming trend in declining health spans, with life expectancy for children now shorter than previous generations in the U.S., despite rising healthcare expenditures. Dr. Wright stresses the importance of empowering individuals to become citizen scientists and advocates for systemic shifts in health policy and cultural attitudes toward prevention and longevity. She highlights the disconnect in healthcare systems where compensation models and time constraints limit doctors' ability to practice whole-person care, leading to fragmentation and a focus on addressing symptoms rather than root causes. In closing, Dr. Wright defines being an ultimate human as living free from physical and mental limitations and having the vitality to pursue one's desires unrestrained by illness or decline. She emphasizes that feeling vibrant every day is key to sustaining long-term health investments, creating an addictive positive feedback loop that encourages people to maintain healthy habits. Her book Unbreakable further elaborates on these themes, providing a mindset and physical framework for aging with power, resilience, and joy. Dr. Wright's work and message offer hope and practical guidance for women navigating the complexities of midlife hormone changes and beyond, striving not just to survive, but to thrive through every stage of life.